Burnout in the neonatal intensive care unit in relation to healthcare-associated infection. This study is an attempt to describe the variation of NICU caregiver burnout by provider characteristics and analyze the relation between caregiver burnout and healthcare-associated infection rates among very low birth weight infants. The Institute of Medicine made an estimation that medical errors account for up to 98,000 deaths in 1999. This was later thought to be a severe underestimate, with numbers actually reaching 440,000 deaths per year. It is believed that patients in critical care require fast-paced and precise care, making the margin for human error considerably larger, especially when pertaining to infants with very low birth weight. These errors also affect the neonatal infection rates, and these increases are believed to be due to burnout. Burnout being described as a condition of fatigue, detachment, and cynicism resulting from prolonged high levels of stress. As earlier stated, the study has two primary objectives: describing the variation of NICU caregiver burnout by provider characteristics, meaning the difference in burnout between physicians and nurses, for example, as well as analyzing the relation between caregiver burnout and healthcare-associated infection rates among very low birth weight infants. Both of these are in attempts to prove that burnout does significantly influence the healthcare-associated infection rate, as well as where burnout is most prevalent among healthcare professionals. In order to answer the questions asked in this study, a sampling was needed. The sampling for this research article was taken from the California Prenatal Quality Care Collaborative, which is a multi-stakeholder group of private and public neonatal groups. NICUs who were participating in the Delivery Room Management Quality Improvement Collaborative were sent the initiative. Out of the 61 NICUs that were a part of the improvement, 44 accepted. In order to take a sampling of the staffing was chosen based on those who worked with a 0.5 full-time equivalent or greater. Those who reached a 0.5 full-time equivalent had to have maintained 4 consecutive weeks prior to the survey. This included all staffing members from attending physicians to nurses and all those in between. Patient sampling. The patients selected in order to prove or disprove this study were patients with very low birth weight, born between January 1st, 2012 and December 31st, 2012. Patients with congenital abnormalities were excluded from this group in order to prevent a bias between data. Survey methodology. The surveys were paper-based and handed out during staffing meetings. They were filled out and put into containers to maintain confidentiality. Those who were unable to attend the staffing meeting were handed the survey with a return envelope to complete the survey. In order to determine the burnout score for each respondent, the 4-question emotional exhaustion subset of the Mallox burnout inventory was used. In order to calculate the burnout scores, the mean was taken from the 4 questions and put into a scale of 0 to 100. The formula used was as follows. In order to calculate and accurately describe responses and demographics from the respondents, descriptive statistics were used. They included frequencies, means, and standard deviations. These descriptive statistics were used in examining the variation in HIA rates and were collaborated to burnout via Pearson's correlation coefficients. For the 2 objectives, the results were as follows. Objective 1. From the survey, the non-physicians reported a higher level of burnout than physicians. Respondents with 5 or more years of experience reported higher levels of burnout than those with fewer than 3 years. Objective 2. In this section of the study, it was found that burnout prevalence did not show correlations with HAI rates. Correlation was seen, however, when workers believed to be overwhelmed and fatigued. Overall, the research did answer both questions asked by the study. It was found that there is a higher prevalence of burnout among non-physician workers. Providers with 5 or more years of experience and those who worked the day shift saw a higher level of burnout. Overall, burnout also did not correlate directly to the HIA rates in the NICU. However, it is believed that those who were fatigued and worked hard were seen to influence the HIA rates.